Welcome to this webinar offered by the national setting of the United Church of Christ, where we are working together to build a just world for all. My name is Sarah Lund, and it's my honor and privilege to serve you as the national setting staff Minister for Disabilities and Mental Health Justice. I am also an authorized minister in the United Church of Christ and serve as local pastor at First Congregational United Church of Christ of Indianapolis, Indiana. I am also a person who lives with a mental health challenge. And so it is in that spirit of mutual support and in that spirit of desiring justice for all that we bring you this webinar to talk about how we can be church during this challenging time through the lens of disability and mental health justice. Before we begin, I want to celebrate our denomination's historic commitment to disability and mental health justice. 2020 marks the 30th anniversary of the Americans with Disabilities Act. We know that the UCC minister, Reverend Dr. Harold Wilkie, was one of the leaders of this effort. And so we celebrate this special connection as the United Church of Christ to this historic effort of disabilities and mental health justice. The Americans with Disabilities Act define disabilities as any mental or physical impairment. And so as the UCC, we strive to be a church that is accessible to all, A2A, and wise for mental health, welcoming, inclusive, supportive, and engaged. And so thank you for joining us in this webinar. We are joined today by our partners in ministry, members and leaders of the United Church of Christ Disabilities Board. And so I want to briefly introduce you to the chair of the Disabilities Board, Jacky Schofield, coming to us from Connecticut. Wave, Jacky. I also
see my hand, there it is.
introduce you to another member of the Disabilities Board. We have Danille Rochford, and she is here from Vermont. Wave hello. Joining us from the United Church of Christ Mental Health Network, we have leaders and board members. We have the vice chair of the Mental Health Network, the Reverend Dr. Rachael Keefe from Minnesota. And we have the Reverend Amy Petre-Hill, who is a member of the Mental Health Network Board. She is joining us from Colorado. Welcome. We want to thank the national setting and all the support staff who are helping us in this conversation. We are seeking to be accessible to all, not to be perfect. And part of that desire to be accessible is providing you with closed captioning. This is currently being done by a volunteer and not by a professional. So please give us some grace as we may have errors in our closed captioning. But it is in the spirit of being accessible to all that we seek to bring you helpful information today. So let's turn to our panel of experts and really begin from the personal. Sometimes the personal is the universal. And so I've invited our panelists first share with us their lived experiences, how they are being impacted today by the global pandemic, to speak from their own lived experience. And so I want to invite our panelists to begin sharing at this time.
Well, I can certainly start. Again, Reverend Amy Petre-Hill here. I serve a congregation, a wise congregation in Aurora, Colorado. And for myself and my community, I've definitely seen an impact on body, mind, and spirit. For me personally in body, needing to do some more yoga to keep that tension from like just sitting in the shoulders like this all day. Also, because scheduling is so different, finding ways to incorporate practices that keep me grounded have been very important, because it's a little harder to hold on to because I live with mental health challenges myself. And then finally, I would say spiritually, getting more help in engaging in spiritual practice by using some apps and some daily hours books for me. In my own congregation, we've been pretty impacted because we've already lost a couple of people, or one person, and the other is at risk to COVID-19. So this seems very at home, meaning the anxiety is becoming something that's shared. We're managing it together, but it's challenging. And for me, giving myself and everyone I work with a lot of compassion and grace as we do the best we can, knowing that we are all beloved children of God, has been really helpful.
Thank you, Amy. And from others, how are you personally experiencing the impact of these times?
I am legally blind, and so for me, one of the difficulties has been an increased frustration with the limitations that I already had. Just feeling times when I'm more isolated than I felt before. And I'm blessed that my apartment has a lovely balcony, and I usually, in nice weather, love to sit outside and listen to the cars go past, which is both connecting me to an outside world, but also reminding me that I'm at home. And one of the things that has really kind of been working on me lately is that there are no cars going past. And I've been finding I actually can't sleep at night because the world got too quiet. As I speak to other people I know, I'm hearing the same thing, that they're feeling cut off from the world around them, even with all the Zoom and the emails and everything else that's driving us crazy all day long, but they still feel cut off. And the one thing in my life that gives me meaning and purpose for getting up in the morning is that I am a chaplain. And I'm still doing that. I'm still going to the hospital part-time and working as a chaplain. They are thinking about stopping that for the time being, and that's going to be kind of my main connection to the outside that's going to be cut off. The other purpose, of course, that God blessed me with was the Disability Ministries board, mixed blessing. So I'm trying to look at this as a time to catch up on work and, do everything I can to find the positive in it. So that's how it's impacted me so far. It really hasn't made a major change in my life to date.
Thank you, Jacky, so much. Danille and Rachael.
I'll go first. My name is Danille, and as Sarah Lund mentioned, I live in Vermont. We've been under a stay home, stay safe order for about 3 weeks now. So one of the major changes in my life, which has been a challenge to get used to since I have Asperger's syndrome, is I have been working from home for 3 weeks because I'm an essential worker for human services to house veterans who are homeless. Also, I have a severe anxiety disorder, so I'm presently experiencing the joys and benefits as well as the challenges of telehealth and keeping those connections to help me through the day. One of the other challenges I face is keeping things on routine and taking care of myself in a way that I was taking care of myself before COVID-19 with healthy eating and exercise. And I have found that if I'm not careful, I cannot leave a house for a whole day without even noticing it. Luckily, I have been able to stay in contact with people through Zoom and other sources of electronics and technology. But at the same time, as I've heard everyone else say online, we are zoomed out a little bit. So that's also a challenge.
Thank you, Danille. Rachael.
I, as Sarah said, live in the Twin Cities in Minnesota, and I pastor a WISE congregation in South Minneapolis. And it's been a wild ride for the last few weeks. I have some physical health issues, so I have been staying at home longer than the state order to shelter in place. And that has been challenging, to say the least. I also have a history of depression, so I've been very mindful to keep myself in as much of a routine as possible. One of the biggest challenges to me is that I find myself overly emotional at everything. I was one that would cry at Hallmark commercials before, but now I get teary at every show of human compassion and every hint at human suffering. I'm just the water fountain. And I know that I'm not alone in that. I've spent a lot of time over the last 3 weeks encouraging people to connect in any way that feels comfortable for them, by phone, by video, by any means that is available to them, because what people keep telling me, and I know it's true for myself as well, is that they miss human contact. And while video may not be a great substitute for that human touch, it's better than nothing to be able to see friends and family and community members that they're still healthy, still whole. We've been very fortunate here in the Twin Cities that COVID-19 has not caused as much devastation as in other parts of the country to date. Those numbers are increasing. So far, no one in my congregation has COVID-19, but there are people who are related to them that do. So it's been a lot of managing anxiety, my own, as well as everyone else's. I get very anxious when I see people not abiding by the rules, not staying at home, not sheltering in place, not wearing face masks in public, because I am so vulnerable to the illness, as well as all but about 4 people in my congregation. We figured out that there's about 4 who have minimal risk factors out of over 100. So it's really concerning. So I've managed that by walking the dog more. We do 4 or 5 miles a day. I do more yoga. I do more reading of just mindless things, just novels, things that distract. I make sure that I limit the amount of news I consume in a day, just to keep that concern under a sort of more reasonable level. But it's been challenging, and what I keep telling people, mostly so I'll remember it myself, is to be gentle with yourself. We're all doing the very best we can under these extremely abnormal circumstances.
Thank you all for sharing. I know that we all are human. And so while we may be in leadership positions, we are human. And so acknowledging our own humanity and our own need for health and wholeness and self-care, we wanted to begin this webinar by connecting to our common humanity and that we're all in this together. We all are also part of communities, family units and church communities and cities and towns. And we want to lift up the intersectionality of disabilities and mental health justice with other forms of justice, economic justice, racial justice, immigration justice, LGBTQAI+ justice. And as the United Church of Christ, we believe in justice for all. And so as we think about not only how this impacts us as individuals with disabilities and mental health challenges, we also acknowledge the community impact. And while some of us and those on the panel here, we represent a certain race and maybe a certain class, we want to acknowledge that there are voices that are not present. And so we acknowledge that we have room to grow, to include more diverse voices in this conversation. And so I want to turn to our panelists as we talk about our own communities and what you're hearing from others in the disability field and in the mental health field about how people in the wider community are impacted. And Jacky, let's start with you.
I was able to make some phone calls to some friends that work with different advocacy groups and to kind of get a feel of what they're hearing out there. Of course, one of the biggest impacts is economic with the job losses, and people with disabilities can be particularly susceptible to that. They often have their Social Security, their SSDI, and they only have a part-time job in addition to that. And so the loss of that part-time job can make a big difference in their economic situation. There's also a loss of a feeling of community from being cut off from opportunities for socializing, and there's a lot of feelings of isolation. There are a lot of people who have physical disabilities, or especially mobility disabilities, find that there's a lack of support for people who are physically unable to deal with changes in the routine. And one example in particular is a woman who does have some mobility issues. She's a hard time walking, and she has heart issues, so she doesn't have a lot of strength. She lives in a subsidized apartment complex where there's multiple buildings, and the sort of gatekeeper of the complex, or security, is not allowing deliveries to be taken to the buildings. And so they tell her, or have tried to tell her, she has to come to the gate to get her groceries. And she says, first of all, I can't get to the gate. And second of all, I can't carry the groceries. So there's a lack of sensitivity to the special needs of people with physical disabilities. There's a sense of a fear of kind of being left behind. Municipalities, many of them have failed to consider people with disabilities in their emergency preparedness plans. So people are calling their town halls and saying, what help can I get? And they're saying, what? They're just not ready for it. The city next to mine is a fairly decent sized city, over 100,000 people. They have absolutely no plan for what to do with people with disabilities. Some people have expressed concern that if they do become sick and go into the hospitals, that they will be treated differently. That the doctors will consider people with disabilities expendable. And to some extent, that is not untrue. Right now, we have the resources we need to treat everyone equally. But if those resources run short, hospitals will be forced to triage. And if you have two patients and one is 20 and otherwise healthy, and one is 70 with COPD and diabetes, and you only have one respirator, who's it going to go to? So that is a very real fear, that people may not be treated equally when they go to a hospital. People who are cared for at home and who need medical equipment at home are afraid they're going to find themselves cut off from their supplies. There are people who use respirators at home and they may not be able to get them. I myself I take hydrochloroquine, and I've had a big battle the last week with CVS trying to get some of it, because other people are getting their doctors to prescribe it to them because they think it's going to help. And so it's getting to be in short supply. I also talked with a group that we have. I live in Greenwich, Connecticut, and we have an organization called Ableist, and Ableist serves a community of people with developmental disabilities and other disabilities, and they run job training programs, and they manage residences for them and help them to live as independently as possible. And I spoke with the director of Ableist, and she told me that their clients are scared, confused, that they hear the news, but they don't really understand what's going on. So they don't understand why they've lost their jobs, why they can't go out, why they can't go to Special Olympics and all of the activities that they take part in. So that is, that's most of what I've been hearing. Mostly just how everybody is isolated from the things that they thought they could depend on.
Thank you, Jackie. So important to lift that up at this time. Amy, how about you sharing with us what you're seeing the wider impact of this in the wider community regards to mental health?
Sure. So I serve both in the community, as you mentioned, and at church. And there's basically two groups that I've seen different challenges for during this time. One, for those that are getting community mental health services who maybe have a more persistent mental health challenge. They echo a lot of what Jackie just said. about feeling isolated. They may also be living in a group home, and the heightened tensions increase friction sometimes between people who live together, and a fear of going to the hospital. Because exactly as Jacky said, this sense that, well, when they see I have a schizophrenia diagnosis and I take all these pills, maybe they won't want to help me. So that's very real. And talking about that and holding that and taking that seriously is important. Trying to find ways to be in touch has been really important, such as doing lots of Zoom support groups, spiritual support groups. At my church, we've added Tizay services, Bible studies, small group discussions if people really need to connect and feel nervous, and we'll do a contemplative practice together. That's been helpful. I think also just creating safe spaces where people can come in where they are, and I hold that also for pastors, helps, because getting that reflection back, yeah, this is hard, is helpful. As Jacky mentioned, we have a ministry of adults with intellectual and developmental disabilities that live in group homes around the Aurora area. And the challenges have been finding ways for them to connect to the congregation if Zoom is just not something that makes sense for them, helping them get on the telephone, because there is that sense of isolation. And I think taking the time, at least at our church, to reframe the news or to talk as long as is necessary, to work out and talk out and think about, okay, what is happening, has been helpful. And that means maybe daily phone calls from people that in the congregation from me or people that they trust to check in and go over what they're hearing in the news. I think for everyone else, okay, I'm sorry if my microphone went out. Something else we're finding helpful is trying to demonstrate with church leadership how to live in this time, admitting that we're all feeling anxiety. It's like you're not failing, we're doing the best we can. And trying to be a source of good information. We're not doctors, but being very realistic about that. The other thing, which I so appreciate my members doing, is members who are at lower risk are willing to take supplies to members who can't get out, can't quite figure how to navigate right now all the different support systems, so that they don't have to worry about food, they don't have money, it just gets taken care of. For every group, inside or out, very constant contact with people that you trust, who love you, and that consistently tell you how important you are. We do have a couple of people with visual disabilities in our congregation, and we're trying in our Zoom worship services to really think about how we can make all of the resources during worship and Bible study available. So, you know, sending out really large Word or PDF versions, because sometimes people can't read stuff on the screen for Zoom. And we're trying to be open and encourage people to tell us what they need, because it can change. So I just echo a lot of what Jacky is saying. We have this shared humanity and shared fear. And if you have a disability, there is fear that you may be overlooked. And so I think it's up to the church to speak up.
Thank you, Amy, so much. Danielle, we'd like to hear from you about the impact you're seeing from a disability lens in the wider community.
Well, so homeless individuals who I support a team are higher risk for disabilities and mental health challenges. And luckily, in ordinary time, Vermont has a great safety net for individuals experiencing these challenges. And during this time, we have really stepped up statewide, our state is housing anyone who is homeless at this time, no questions asked, and they are really encouraged to reach out to our state Department of Children and Family and get housed, because it's very difficult to shelter in place when you have no shelter to do so. My church is also still running a small potato Saturday morning breakfast and brown bag lunch, and dropping brown bags off outside the church building, as well as our regional program, which serves New Americans and people who are poverty level with basic needs such as laundry and cleaning supplies. The organization I work with, we've expanded our support line services, which are open to anyone who's experiencing anxiety or depression, from 15 hours a day to 20 hours a day. So we're open from 10 a.m. to 6 a.m. With people who've been trained and have lived experiences. We are also delivering supplies and food to our clients with no contact drop-offs, and still meeting with clients through tele meetings. And this month alone, we've housed 22 individuals in the state of Vermont, people who have disabilities or mental health challenges, and veteran families, which is the largest amount of individuals we've housed since my organization started 10 years ago. We also have online programming still. We have a community center that unfortunately we've had to close due to social physical distancing. So last night, some of us read poetry and sang pandemic themed guitar ballads to work out some of our stress and frustration. We're also still keeping a house open that we call Soteria House, which is for people who are experiencing psychosis. And since the hospital is really saving space for people who have COVID-19, it's been really helpful because they can still be in the community and get support from their peers. One other thing that I've experienced as a ministry student right now is the level of mental health challenges that my classmates are going through, and just feeling really, really stressed out between still having to do class and dealing with their other jobs, since I go to a program that students have a second career with their children and families. So right now, what I've been experiencing at Phillips Seminary in Oklahoma is that they are working with us to provide spaces for forums and to talk things out, and giving us different expectations at this time so we can still meet the expectations of the program, and also giving us the ability to bow out if we're unable to meet those expectations without having an impact later on.
Thank you very much, Danielle. And Rachel, from your experience through the lens of mental health, how are you seeing the impact on the community?
I want to affirm all the things that everyone else has said, because I'm also seeing those things. A couple of areas that people haven't spoken about yet are people who are currently in treatment facilities are having a really difficult time because staff is quitting. I know of a couple of facilities where the psychiatrist, the psychologist, and several direct care staff have left. So anyone living in a facility we know has lots of concerns. There's no contact with the outside, but people who are in treatment, particularly for addictions, it's an exceptionally difficult time. And I also know about students because my wife is a professor and a PhD student at the same time for two different universities. And she's hearing from so many of her students who are struggling with all kinds of things that are unprecedented And some educators understand this and are being very lenient and graceful with grades, and others are not and haven't changed any expectations. And it's really unfair to ask students, I mean, these are college-age students, young adults, to be able to cope with this when no grown-up can cope with this. And I'm also seeing a lot of concerns for families who don't necessarily have the space to shelter in place, or the emotional resources to shelter in place as a family well. There's been an increase in domestic violence, an increase in alcohol use, probably an increase in drug use as well, but I haven't seen those numbers yet. So a lot of concerns for families and young adults who are expressing just so much anxiety and so much fear for a future. You know, I have family members, 3 who are supposed to graduate as seniors from high school this year, and what the loss that has been for them for their senior year. I mean, we can as adults look and say that's not such a big deal in the grand scheme of things, but for these teenagers, it's a really big deal. So to just hear the concerns and validate the fear and the anxiety, because it's all an appropriate response to a really bizarre situation, and try to remind people there are resources out there. Like, if people have the technology, telemedicine is a great thing, both for physical health and for mental health. A lot of therapists are able to use telehealth to support clients. I know I have been offering spiritual direction, pastoral counseling to anyone in my sphere, whether they're members of my congregation or not, just because people need to have their fears heard and validated and held. And it's hard to make space for that because we all have our own anxiety to deal with, but we really need one another in ways that we have not needed each other before. Or at least not realized we've needed each other. I think we've always needed each other more than we know, but it's been really hard to listen to all the needs and the valid fears. And I share the fears of people with disabilities. I received a pacemaker in December, and that's the first thing somebody's going to see if they look at my medical record. So if I need to go to the hospital and there's me and there's someone even my same age, in my early 50s, if there's another person with the same age, they're going to get the ventilator before me because I already have a health condition. I understand those fears. They're real, and knowing places that have had to make choices about who gets a ventilator and who doesn't, it's real. On the other hand, not letting that fear consume us, you know, trusting that, you know, I'm okay today, and today is what I can deal with. And just focusing on the blessings of the moment has been the only advice I can give to people who ask for advice. Most just want to know that their fears are justified. So I've done a lot of listening and a lot of just making space to share that fear and anxiety because it's real.
Thank you, Rachel. I would like to add, in terms of the impact on communities from a disability and mental health lens, this came up in conversations with colleagues, is that for many years, people in the disability and mental health communities have asked churches to be more accessible. People who, for various reasons, aren't able to leave their home have desired to experience worship and connection to the church. And for years, the church has said, we can't do it. We can't afford it, or we don't know how. We can't offer you worship online, and we're so sorry. And so there's been this expression of lament from the disabilities community that overnight, all the churches who said they couldn't afford it or they didn't know how to offer online worship are suddenly offering online worship. And while that's a wonderful thing, it's also a point of great sadness and pain because it's another example of ableism, of a bias towards people who are able-bodied, thinking that people who are able-bodied have a higher value and a higher worth, that we'll do things for able-bodied people that we would never do for people with disabilities. And so I think it's important as a church to reflect on what this says about us and our bias. And I've heard colleagues say, once this is over, we're going to go back to the way it was because in-person church is the best and it's the most important way to be church. And one of the things I want to invite us and challenge us is that we don't go back to being biased against people with disabilities, biased against people with mental health challenges, that we embrace this as a way to be a more accessible to all, a more wise, welcoming, inclusive, supportive, and engaged church. And so that's a piece of the story that I think is important to lift up as well. As we turn the corner in our panel, we're going to start sharing resources that we want people in the church to have access to. And I also want to invite participants to share in the Q&A that's at the bottom of your screen. You can type in your questions, and during the panel, we'll seek to answer them. If we can't answer them in the panel, we'll find other ways over the course of time to address your questions. So feel free to engage in the Q&A at the bottom. We'll turn to our panelists with this invitation, each of you in your own ministries and expertise. What resources would you like to share with people that can help address disability and mental health justice? And Jacky, we'll start with you.
Muted, okay. I've always found that at least in my town, our pastors are very much connected with, sorry, I don't know how to stop that phone. But our pastors are very much connected with all of the social services in town. And I think it's very important for pastors to make sure that they've gathered that information so that they can share it with people in their congregation, but people just out in the community. And there are some organizations that are well known nationally. For instance, the Red Cross, of course, every municipality has social services. The United Way is working very hard to fund different programs that are helping people with disabilities and seniors. And one that I didn't expect to hear about, I was speaking with someone from the local branch of the National Federation of the Blind. And he told me that the local chapters of the NFB are usually very involved in advocacy in their local communities and in their states and even nationally. And so they're very knowledgeable about programs that are available. Even now, very knowledgeable about how and when people can apply for unemployment, and what help they can get with rental and housing, and who to call for help if your landlord's trying to evict you. And he said, you don't have to be blind to call. They're happy to share the information with anyone who needs help. In our town, we have a number of local organizations that have really stepped up and repurposed and refocused what they're doing. Our local food bank moved to a new location over the course of a weekend in order to expand their services. We have several other groups that have cropped up just to deal with this crisis, and they do everything. They organize volunteers to bring deliveries to people with disabilities and seniors who can't get out to the stores. And they do a lot of different things. Some of them work with children at risk. They've partnered with the local newspapers to hold up case studies of children and families who are in dire need of help at the moment. And they're asking for people who do have financial resources to send in money to help with rent, to help with food, to help with whatever those families need. And so we just have a lot of different things going on in the community where people are really coming together and working to help each other.
Thank you, Jackie. Amy, any resources you'd like to share at this time?
Yeah, I have several. I have a list which I can attach, but I think you guys are going to do that. Really look on the UCC Disabilities, Ministries and Justice, Mental Health Justice page, because there's a long list of crisis lines. And I want to encourage people to think about, especially pastors. We think we got it together. We think we have to be strong, but we all hit these points where we need help grounding. And sometimes we have colleagues that we can call. Sometimes we have therapists. Sometimes we have those resources. Sometimes we don't. And when we don't, there are sorry about that. That always happens. I don't know why. There are mental health resources and crisis lines that you can call when you're not yet in a crisis, and get those resources, and also share them with your congregations, because you also can't hold everything happening. And there are professionals out there that are available for that. And I'll give an example. Here in Colorado, we have a Colorado Crisis Services, but it has a peer support warm line. And when pastors or even people out in the community have gotten really stuck and overwhelmed, they've been able to call and just talk with somebody who is peer support trained, doesn't have to be a crisis, just to do some problem solving, to unlock things, to express things, and then they're able to move forward. And I think we need to destigmatize asking for that kind of help, because just like wearing a mask to help keep yourself and other people healthy, calling in mental health resources and supports for yourself early is like that. It's going to prevent something more serious from happening. And, you know, I know a lot of pastors are also finding ways to provide appropriate amounts of mental health support in concert with mental health professionals, because that's important. The two should work together. So I wanted to share that. I know that NAMI across the country is offering a lot of spiritual support, not spiritual support groups, peer support groups, family support groups. A lot of them have gone online via Zoom. So even if you've never been on one, if you need to be on one, you don't have to, it's anonymous, you don't have to share anything. Those resources are out there. So does the Depression and Bipolar Support Alliance. And they're prepared for more people to come. So, you know, try it out. And again, stomp that stigma by taking care of yourself and not worrying about this. For clergy who feel like they need support, but certain things they don't want to talk about in their association or conference. I just started, and I put the info out there for a clergy support group that's going to start, or, you know, member in Discernment that's going to start next Thursday. You can contact me, my info's in there. I'm sure there are other resources and people like Rachael and other people who may be offering something like that locally or nationwide. So you can talk to someone outside of where you serve if that feels safer. And
Thank you, Amy. We will ask Danille for you to share resources that would be helpful to others during this time.
Absolutely. So someone just mentioned it in a chat box, and I think Amy was getting to the point. I think one of my biggest resources personally has been my spiritual director. I only meet with him once a month, but I emailed him last week because I was feeling a little bit like I hadn't talked to him in months. And he was happy to just respond and let me know that someone was hearing me right now. So if people don't have a spiritual director, I believe someone posted a link where they can find one, and most UCC conferences have a list of spiritual directors within their community. Another resource that can be made by a few people that my workplace is using is co-reflection, which is an hour-time conversation with people who just check in, say where they are, and talk about relationships and how to communicate and connect to everyone. Per my specialty with housing veteran people, I just want to mention the Veteran Crisis Line through the VA, which is open for calls and text messages, so you don't need to jump on the phone to talk. And also the program that I work for is Supportive Services for Veteran Families. And that program is in every state. And I've included a link on the resource page that I believe will be sent out to find where your state's resources are for that. And as long as someone has served in the armed forces for 3 days, no matter what your discharge is, they will help you find housing if you're literally homeless or close to being homeless.
Thank you, Danille. And Rachael.
Can I just add something?
Sure, Jackie.
Okay, I received something shortly before the meeting, and I wasn't able to send it to you one time, but the First Congregational Church of Storrs, Connecticut has compiled a brochure of mental health resources. And some of it is Connecticut, but it also includes national organizations. And so I could send that to you if you wanted to make it available to share it with other people.
Thank you. Yes.
You're welcome.
Very good. Rachael, for you to share resources that would be helpful.
I support what everyone has said so far. There's lots of resources out there, and look to see what new resources are available in your area. I know in the Twin Cities, there have been new warm lines created just since COVID-19. So take a look at what's available in your area. I wanted to highlight one resource that I've been using with parishioners and counseling clients for years. And it's one that's accessible to everyone who has access to the internet, and it's dbtselfhelp.com. I am in no way affiliated with this website, but most of us are experiencing emotion dysregulation these days. And this website walks you through some basic exercises that can help you reground yourself and face the day a little better. And maybe engaging in some of these activities will prevent the need for further intervention, or at least enhance any treatment that you're already following through with. And if you have been in therapy before and you find yourself in need again, reach out to a therapist and see if telehealth is available. And if you've never been in therapy but would really like someone to talk to, check out who in your area or who is available to you through your insurance to do some telehealth. I mentioned in the comments that I have been offering spiritual direction or pastoral counseling to clergy, particularly. So, and I included my email in there. So if you're in need of that or want to hear more about what it is that I can offer, feel free to email me. And I see somebody who's wanting that website, which I will put in the comments as well. But really, it's look and see what's available in your area, in addition to all the national hotlines and resources that people have mentioned, because I know that every day there's new resources available for local folks. And I also wanted to mention one other thing that my church is doing that maybe some other churches are in a position to do. We're in the process of creating a fund for our friends, members and friends who may have specific need, and they can receive the funds either as a loan to be paid back when they're able, or just as a gift if they know they'll not be able to pay it back. I don't know what shape that's going to take, but it might be something that each congregation can do to whatever extent they're able. So that was just another encouraging thing that seems to be happening locally.
Thank you. There are a lot of resources, and we're doing our best to document them, both here in the comments and also in a resource will be shared after the seminar. The UCC national website has a Disabilities and Mental Health Justice page, and we're also launching a community care space through the national setting. So look for those experiences to be coming to you. A couple of the question and answers that came up was, how are we going to be equipped to be the church in this new reality? And I'm happy to share that United Church of Christ, through Faith Info and through other partnerships, we're launching these every week. You'll have 2 different webinars, one for the head and one for the heart. So we are equipping you with the tools that you need. Another comment in Q&A was from someone who lives with depression, and who shared that when they're feeling depressed, they stay at home and they self-isolate. So this is not new to them. And I've had other conversations where people feel like, welcome to my world. You know, as someone who has disabilities and mental health challenges, I know what it's like to isolate. And so I think we can look to these folks as the experts. They have the experience, and they have a real insights into how we can support and better care for and love each other. So I want to close out the webinar and thank our panelists. I want to thank the national staff and all the support that we've gotten to do this. And I want to thank you for attending this webinar. It will be shareable, it's recorded. And so please share this with others. Before we end, I want to invite our panelists, if you can share a word that would be a word of hope to share with our friends gathered here, that you would give as an offering. And then Danille has a brief prayer to close us. So Jacky, what is your word of hope for us today?
Let somebody else go first.
Sure,
Let me
Amy.
think for a minute.
I'm going to say community. I think faith communities, the larger communities, and those invisible ties of spirit and just humanity is what is going to help us through. And yeah, helping us connect into that is healing and life sustaining.
Thank you. Danille, a word of hope.
God's covenant with us.
Amen. Rachael.
I suppose the word would be resurrection, but I mean that in the context of Holy Week, that reminds us that we worship a God who is present with us in life, in death, and in life that comes after death. And so that to me is the promise to the people of God, as Danille suggested, the covenant that God has with us, that the people of God will continue. We may be changed, but we will continue.
Jacky.
Oh, I would just say, in a time that is so filled with fear and anger, forgiveness and love for each other.
Thank you. Danille, would you please end our time together with prayer?
Absolutely. Loving and caring God, please be with us, our guest today in this webinar, and our world. We ask you to be with us in this time through our physical distancing while nurturing our social and spiritual relationships with others and you. We give thanks to your presence where we journey through this together. Amen.
Amen. Thank you all, and God bless you.
Thank you.